Hi, everyone. I'm Rundy Murphy, epidemiologist and director of disease surveillance at the Mobile County Health Department here on this finally Friday to give you the update of the COVID-19 pandemic on Mobile County. Yesterday, we recorded another 381 cases of COVID-19. That brings our cumulative number of cases to 59,134. Likely by the time we get to this report on Monday, we will have topped 60,000 cases of COVID in our county of just around 413,000 people. Yesterday, 6 additional deaths were reported. That brings our cumulative number of people who have died with COVID to 960. Yesterday, 66 additional people were admitted to Mobile hospitals with COVID-19. That brings the cumulative number to 7,344. Yesterday, there were 461 people in local hospitals with a COVID-19 diagnosis. There's the light. Should I start over? No. Okay. Sorry about that. We were having just a minor technical difficulty with the microphone, but Mark says I can continue. Okay. I had said I think that there were 461 people in Mobile hospitals yesterday with COVID-19. That's a slight reduction in the number, but not really worth celebrating, in my opinion. We've been above 450 people each day for 2, 3, 4, 5, 6, 7, 8, 9, for 10 days. So 10 days with the number of people hospitalized on any given day over 450, and most of those days over 460 people in the hospital. So again, this is just a really difficult time for our healthcare system, not just our hospitals, but our emergency responders. Urgent care clinics are overwhelmed. The demand for testing is beginning to sort of outpace the testing availability. We have had very long lines waiting for testing in our clinics today. That's why we were a little bit late. I was covering for a clerk downstairs while she took a brief lunch, and people are just, waiting hours to get a free COVID test. We're glad to be able to continue providing that service for as long as we have tests available, but we do appreciate your patience, and the lines are often quite long. So the State Health Department issued a news release today just talking about, the fact that COVID-19 is surging in Alabama children, and that vaccination and other measures are needed to prevent further spread. So in Mobile County, just over 5% of our cases in the last 2 weeks were in people, or in babies and toddlers 0 to 4 years old, and another 15% in people aged 5 to 17 years. So that's 20% or over 20% of the cases in those ages 0 to 17, so babies and children. And I saw a statistic earlier today that when we compare the number of cases among children this year to last year, it's gone up something like 386%. So we're all really concerned with the start of school, the low vaccination rates, very few children that are 12 and over and eligible for vaccine that have been vaccinated, and then of course the children less than 12 who aren't eligible for vaccine. We just really urge everyone to get vaccinated and employ other measures to prevent further spread. So again, coupled with the increase in cases, the State Health Department noted that Alabama has at least 50 children hospitalized statewide and has recently had at least 9 children on ventilators in a single day. And again, this is attributable to just wildfire spread and the greater infectiousness of the Delta variant and just not able to slow the spread because we have such low vaccination rates. And this is spilling over into our pediatric population that can't protect themselves and rely on their parents to protect them. So it's a pretty serious situation. Dr. Landers, who's the state medical officer who's quoted in this news release, says that, at least 113 children in our state have suffered from the COVID-related illness called multisystem inflammatory syndrome of childhood, which is a severe illness that occurs after COVID disease affects organs including the brain, heart, lungs, and kidneys, among other body systems. So again, 99%, 98%, 99% of the COVID that we have out there are Delta variant. So everyone, I get asked a lot of times, like, if I tell someone they tested positive, they want to know, like, is it the Delta variant? I say yes. Like, well, did you test it for the Delta variant? I don't have to test it. I know that if you are getting COVID right now, it's the Delta variant. So there are some other information in here in this news release talking about the how COVID is affecting children, and some information about the need for masking and continued excluding school-age children if they have COVID or if they've been exposed to someone COVID. There's been a lot of confusion about this, but there are very rare exceptions to quarantine, and that is if you're fully vaccinated, you don't have to stay at home. If you're exposed, you can wear a mask and test and monitor your symptoms. And if you're a child in a K through 12 classroom wearing a mask, and the child who's diagnosed with COVID was also wearing a mask, then the COVID kid has to be excluded from school, but the COVID exposed kid who was wearing a proper mask could stay in school. But every other situation of having COVID or being exposed to COVID, when it happens outside of the K through 12 setting, the classroom setting, if you have COVID, you have to go home for 10 days. If you've been exposed to COVID, you have to go home for 14 days preferred. But for 10 days, if you are asymptomatic on day 10 and you continue monitoring for symptoms for days 11, 12, 13, and 14. All right. So again, the only people that can protect our children are our parents or guardians. So please do everything you can do to protect your children from getting COVID-19, because yes, most of them will survive the illness and will recover and go back to normal health, but many of them will not. All right, there was also another question about a federal team that's headed to Baldwin County and asking if similar teams are coming to Mobile. And my best answer to that is I don't know. There have been multiple requests from hospitals, from emergency management agency, from governmental agency for federal assets or federal assistance in all different ways, shapes, and forms. But as you can imagine, those are pouring in from all over the United States. So we have not been told that any federal assets, any additional federal assets are coming to Mobile County.
Please reiterate, we don't tell the schools what to do.
Okay. There are some comments, I think, coming along Facebook about how Mobile County Health Department interacts or advises or orders schools. We don't order schools. These are not mask mandates. They are not, we don't close schools. We don't make up the rules for schools. What we do is we interpret CDC guidance and we pass along the best practices and the best guidance on implementing prevention strategies for schools. When a school calls me, or a daycare owner, or a child center or kindergarten, or any type of school, even an institute of higher education, the decision as to whether or not to keep your school open is, do you have enough teachers to provide instruction and to your students and keep them safe, or do you have enough unexposed students to continue having classes? So generally what happens when a school starts seeing COVID transmission among their students or staff, it will, particularly with Delta, it will happen very quickly. You'll go from 3 to 12 to 30 cases of COVID in the matter of 3, 4, 5 days. And generally when you're testing people and you've got 10%, 20% positive, you really have no choice but to close your school, because you can't keep all the cafeteria workers are gone. You don't have enough bus drivers. The custodial crew is, at half what it should be to keep the schools open. And so those are the things that usually lead to a school closure by a school administrator or superintendent, not the health department telling you that you have to do that. All right, let's see. Just a couple of questions from Facebook. So let's see. Here's a comment. I think this is a comment. Something about a councilman pointing to Dr. Eichold as the individual who has the power to create public health orders. And I said that municipal governments develop and implement mandates. So let me correct this. This statement says that I said that it's on the municipal governments to develop and implement public health mandates. I did not say that. I said it is up to the municipalities to close schools, to implement, not close schools, close streets, to enforce curfews, to limit occupancy, to, implement a mask mandate. I did not say that it's up to municipal governments to implement public health mandates. And this person goes on to say, it sounds like no one wants to politically be responsible for an unpopular mandate. Well, that's true. I mean, people don't want to implement mandates or, wield their power or perceived power as a government official or a health department because we shouldn't have to. We don't want to. I mean, we're all smart people. So we don't have to be told that wearing a mask is the right thing to do. We know it's the right thing to do. So at this point, last year we didn't have a vaccine. We didn't know what was going to happen. We made some very difficult decisions to, limit, the state did, and Dr. Eichel did as well, to temporarily, pause delivering services in places where you couldn't wear masks, like restaurants, that sort of thing. But, now all the restaurants are open, all the businesses are open because everybody knows what it takes to slow spread. Wear a mask, distance, and get vaccinated. So it has nothing to do with politics or power or finger pointing. It's that we all have a personal responsibility to do what is right. We should not need politicians or health officers ordering us to do the right thing to protect our community. Is it safe for a child 11 years old, high risk, to take the vaccine? Right now, the vaccines are only authorized for people 12 years and older. Can you get COVID twice? Yes. Natural immunity that is developed during a COVID infection lasts about 3 months, we think. It's very unlikely that you would get COVID a second time within 90 days of getting COVID the first time, because natural immunity is not a long-lasting, high level of immunity. And particularly when we start seeing different variants, it's very possible that you could get COVID twice or 3 times or 4 times if you're not vaccinated. You will get better protection. Your immune system will respond better to a vaccine. So here's a question. Are you using a different test for the Delta variant versus the original COVID virus? The main tests that we use are not different. We're still using PCR test and we're still using rapid antigen test for COVID. So those have not changed. However, we do have new tests that have been developed to specifically determine what variant of COVID is in that specimen. Those are more expensive and you have to special order them. So that's why we generally only collect that information on just a sample of the COVID positives that we have. We don't spend the extra time, money, resources to determine in every single sample what variant a person has. Can toddlers be carriers? Yes, toddlers can be carriers. So anybody that tests positive has virus in their respiratory system. So if a toddler tests positive, it means that he or she has virus in their respiratory system, and if they cough or if they sneeze or if they blubber, those respiratory droplets can infect someone within, distance or in close contact with them. Let's see. Could elementary schools get mobile testing units and or high school get any vaccine and testing clinics. We have done a few vaccine clinics at schools. We have done a few testing clinics at schools. Some schools are very receptive to the idea of having on-site vaccination or testing, and some are not interested at all. There is an effort underway, a partnership between the Alabama Department of Public Health and the University of Alabama Birmingham School of Public Health for an initiative to bring voluntary screening using COVID test screening to schools. They're going to pilot that project in Montgomery County, and then schools have been a little cool to the idea of testing in the school because for all kinds of reasons, you need parental consent. Who's going to do the swabbing? They're already short-staffed on nurses. What if they have some positives? Who's going to call the parents to exclude them from school and find out who they've been around to try to exclude them? So there's a lot that comes with it. But we've told all of the schools, both the superintendents and the nurses, that should they decide to embrace testing as a measure to reduce the spread of COVID in their facility, that we are happy to partner with them and to come to their location and assist by providing testing of students and staff, particularly in an outbreak setting, so that we can know who is infectious and exclude them from the school setting. That's one of the best ways to stop or to slow down an outbreak once an outbreak starts. Someone asking about masks not being required at daycare. So right now, the new guidance, the new one-pager that came out from ADPH that I showed yesterday, talks about that if, in school settings, and this also applies to daycare, anybody over the age of 2, regardless of vaccination status, should be wearing a mask. I mean, that's pretty much true for everybody, whether you're 2 or 20 or 80. Right now, because we have so much COVID and we have such low vaccination rates, everyone should be wearing a mask indoors, and everybody should be distancing from people that you don't know, particularly that you don't know the vaccination status of. Let's see, since staying at home is so important, and I constantly reiterate it, does the health department recommend parents keep their elementary-aged kids home, homeschool them now if possible, because there are no good virtual options? But this is a really, really difficult situation, and it's such a family-centric decision, really a decision between parents. Kids do better. Wellness, education, mental health, behavioral health, social health, health and nutrition, all of the exercise, all of those things are better when children are in school. I mean, it can be done well in a home setting, but homeschooling is not for everyone. So the majority of kids, our society does better when kids are in school. So any decision to opt for a virtual environment, a virtual learning environment, or homeschooling or keeping kids at home, this is a really important discussion and decision to have among parents, grandparents, school teachers, the child, to try to determine. In a perfect world, your whole family is vaccinated and you send them to school and they wear a mask. That's the best you can do to protect yourself and your child. In a situation where maybe the smaller kids aren't vaccinated, still send them to school with a mask. But if your school lets monitor closely, and if your school starts to report cases, then decide as their parent if the risk of them being at school outweighs the benefit. Maybe you keep them home, for 14 days and try to see if the outbreak slows down. But these are really difficult decisions. Usually when Delta variant hits a household, everybody in the household is going to get COVID. So if you have one kid at school, if you have one kid with COVID or one parent with COVID, you should keep all the kids and all the parents at home. Let's see. There's a question in here about the reporting requirements for reporting COVID cases, that they heard that it's not required. I don't know what the latest is on that. I'm going to have to check on that one, Mark, and get back. I know many schools are reporting numbers of COVID cases and people who have COVID and people who've been excluded from school because they're quarantined for COVID. Like the Mobile County Public School System, I think, is reporting that on their public website. Last year, schools were told to public schools were required to report that to the Department of Education, and then those data were displayed on the Alabama Department of Public Health website. I don't think it was a requirement for private schools, though many private schools did report numbers on their own websites. But I'll have to check and see if that's what we did last year is still happening this year. And then the last question, are there any backlogs of reporting in Mobile County? I haven't seen a backlog in a really long time. Keep my fingers crossed. As soon as I've been asked about this, it'll probably happen tomorrow. But I've not seen any major spikes or backlogs being processed. What we do see is a very obvious and natural Monday through Friday effect, right? Or maybe I should call it the weekend effect, where you have fewer doctor's offices, urgent cares, hospitals testing on the weekend. So on the Saturdays and Sundays, we usually see a lower number of cases reported following a Saturday and a lower number reported following a Sunday, and then it'll start building back up as we go Monday through Friday. So that happens. It's very cyclic. We see that with a lot of other conditions, but I've not seen a large backlog in some time. Mark, are there any other questions we can answer before we go into the weekend? So let me just say, the hospital, the number of people in the hospital, while at historic levels, very concerning, very challenging for the hospitals, super high levels of people hospitalized. It has been fairly stable for 10 days. I suspect that next week we will see a slight reduction. This week, when we compile the data for this week and report it on Monday, it will probably be a slight reduction in the number of cases reported compared to previous weeks. But school football started last night, and there are other games tonight, and school is back in session. So we're keeping a watchful eye on what all of this, congregating, not wearing masks, extracurricular activities going back, just keeping a watchful eye on it, because I expect that it will cause another slight uptick in the number of cases reported in 2 weeks or so. And of course, in 2 weeks or so, we have Labor Day. And we all know what happens after Thanksgiving, after Christmas, New Year, after Memorial Day, what happened after July, nearly, took my knees out from underneath me. So we know that these holiday events lead to an increase in transmission, and then it shows up a couple of weeks later. So it is probably going to be a good month or more before we start to really have an opportunity to see us, start trending downward, more than just 1 or 2 weeks in a row. You can stop that. You can change it. All of you can. I can help. I've helped by getting my vaccine. I help by wearing my mask everywhere I go. I help by distancing from people that I don't know. You could do the same thing. Everyone could do the same thing, and we could change our expected outcomes. We could change the predictions that I'm providing here. So we can change it. We have the power to write our history. But we all have to be willing to do the right thing and to do it together. Get vaccinated, wear your mask, distance from people that you don't know, stay at home if you have COVID or if you've been exposed. So I will end with that and say, everyone, have a great, restful weekend, and we'll talk again on Monday.